Doctors of Reddit. What is your craziest story where a patient present with mild symptoms, thinking it was nothing, and it turned out to be a serious life or death situation? Story 1. Patient's wife called. Patient had a temperature of 98.6, no other symptoms. I explained that was a normal temperature, but the wife said that a fever for him. She said she felt like something was wrong, despite no other symptoms. I told her that I respect that, and that if she feels something is wrong, she should get him checked out in the ER. The ER doctor called 4 hours later and said they did all they could do for him, but he died of sepsis. He appeared to be normal when he got there, but rapidly declined. That gave me a new appreciation that we truly can't evaluate someone thoroughly over a telephone. Story 2. I'm a nurse, not a doctor, but we had a guy coming years ago asking for a medication to help him stop sweating. He said he had had a sore throat for about a week, went to a walk-in clinic, was diagnosed with strep throat, and put on antibiotics, but he was so sweaty and just wanted a break from it. He looked pale and was indeed sweaty. So we took him back and ran some blood tests. His white blood count was the highest I've ever seen, and he was diagnosed with leukemia. We sent him to another hospital for immediate treatment, but we were informed he died literally hours after arriving. Incredibly sad. I couldn't believe it. Story 3. Saw a patient with minor cardiovascular symptoms and a slight pain in his upper back. The senior debated back and forth whether it would make sense to run a CT to rule out anything more serious. She finally decided to do it, and it turned out he had a massive aortic dissection and was basically wheeled right into the OR. Story 4. I'm a dentist. New Point came in with what he thought was a mild ache in his teeth. Thought it was a toothache, hadn't seen a dentist in years. Took a radiograph and the jawbone around the teeth looked strange. Had him see an oral surgeon that day. Turned out it was a very aggressive metastatic bone cancer, and died a few weeks later. Story 5. My dad woke up with severe back pain one morning after not doing anything strenuous the days leading up to it. My mom flipped her and finally put her foot down that he had to go to the doctor after him putting off going to the doctor for years, even for a routine checkup. That appointment showed a broken rib from a huge tumor on his spine, along with tumors around his buttocks, pelvis, and upper back, diagnosed with stage 4 lung cancer. 5 years and 100 treatments later, he's still kicking it. Story 6. Still in school, and I was not present for this patient's initial admission, but rather her clinic follow-up. However, patient was healthy 50-something-year-old who had an extended nosebleed after a long hike. It wouldn't stop, so they went to ER to get it cauterized. Impact. It happens all the time. Anyway, they did a CT scan as protocol and discovered she had a 20 centimeters tumor on her uterus that was wrapping around her right kidney. She was immediately referred to a serious academic hospital and had a specialized oncology surgeon remove it. Amazingly, they got it completely removed without even having to damage the kidney. She had an amazing outcome and about a half-a-foot scar running around her abdomen from the surgery. Edit for clarification, I do not believe the CT scan was due to the nosebleed itself, but rather I imagine as they looked further into her blood work and coagulation studies, they found something that warranted further workup. Story 7. A man came to the hospital because his wife always complained about his bad breath. Long story short, I met him because they consulted my department when the tissue biopsy came back as esophageal cancer. Story 8. Not a doctor, but worked as a security supervisor at a hospital. Man and his wife came in. Man is feeling unwell, thinks he has like a flu or a cold or something. I can't remember exactly what. Nothing serious, but they don't have a family doctor, so they came to ER. Man gets in line for triage, and his wife leaves to go park the car after dropping him off. Like I said, I'm not a doctor, but how it was explained to me was part of this man's digestive tract just exploded because he sits down, and within 30 seconds, he's slouched over and dead. My guards respond, realize he's not responding or breathing, and pull him onto the floor and start doing compressions. EMS and nurses quickly join us from the back and rush him to a triage room. But whatever happened wasn't recoverable. Wife got back in her, just expecting him to be hanging out in line. Instead, are met with my guards telling her that her husband is dead in the back with staff, trying to bring him back. Like, I can't even imagine how that is from the wife's perspective. She leaves with her husband basically fine and wasn't gone for more than 5 minutes and comes back and he's just gone. I was on break at the time and missed the situation, but had to come back and deal with some shell shock guards. Story 9. Mom was constantly in and out of doctors' offices and ERs for many things, such as extremely tired, extreme weight gain, periods lasting months, and a bad case of dehydration. Finally, an ER doctor took notice and sent her for a CT and found a grapefruit-sized tumor in her vena cava, later diagnosed with stage 4 leiomyosarcoma. Gave her a few weeks to live, but she battled for about 5 more years. Edit spelling. Story 10. Not a doctor, and not my story. Something I read on a similar post a ways back. An ER doc was running some baby docs through training when a disheveled man in an old rumpled suit obviously homeless, came in complaining of nonspecific malaise, kept mumbling about quantum whatever under his breath, wasn't all there, mentally. She thought he was drug-seeking, but opted to run him through basic diagnostics to show the baby docs how it was done. Turns out the dude was in full-blown kidney failure. They put him on dialysis, and he just snaps into focus. Complete turnaround, 100 coherent. Turns out dude was an actual professor and expert on quantum mechanics, and was riding a train to a conference when he entered kidney failure. It addled his brain, and he wandered off the train at a random stop in a state of confusion. Had been roaming the streets for months like that. Somehow, didn't die. Crazy. Story 11. I was the patient. Spent 6 months being told I had a bad cold and anemia, so I should take iron pills. Turns out I had an autoimmune disease, and my kidneys were failing. I eventually ended up on dialysis, and with a transplant. Story 12. Many years ago, when I was in my residence, a man entered ER with a hand in his forehead, walking by himself, asking for a doctor. You can imagine my surprise when I said yes. To him removing his hand and showing his injury, a perforating hole from a bullet. He was quickly moved to surgery after that. Later, I found the bullet didn't reach the brain. It was well buried into the skull bone. Story 13, not a doctor's perspective, but my dad went to his doctor because he suddenly didn't like the taste of broccoli. Dad was otherwise healthy, late 60s, fairly active guy. He was diagnosed with leukemia. Story 14, probably not particularly crazy. It might happen all the time for all I know. Not a doctor, but I went into urgent care thinking I had a nasty UTI, but it turned out to be severe sepsis. Got whisked away in an ambulance on oxygen. That's what I get from my mom teaching me. It's all in my head. Story 15, I was the patient. My mom kept bringing me to the doctor because I was continuously complaining of tummy pain. I had just started school. The doctor said I was likely just trying to get out of school and stay home with my mom. I complained the whole school year. She even brought me to the ER a few times, and they essentially said the same thing. They never did any imaging, sometimes blood work. Finally, one day, I started peeing blood, and she took me right to the children's hospital, and I was diagnosed with stage 4 kidney cancer. By then, it spread to both lungs, liver, lymph nodes, and around the heart. Story 16, I don't know if it counts, but I got bit by a bat and thought I should go get the rabies vaccine right away, and my wife said it's expensive. See if you even get sick, and I almost listened to her advice until I looked up what the first symptoms would be to know what to watch for, and everything was pretty unanimous. Once symptoms start, it has a 100 kill rate, and if you get bit, it's non-negotiable. You should go for the vaccine ASAP. Story 17, when I worked in AE, I had an elderly man come in to Miners with his son-in-law. Symptoms were constipation, mild stomach pain, and a bit of abdominal distension. They were just asking for laxatives to relieve his constipation. I examined his abdomen and found a firm central mass, which was a bit unusual. We were taught in medical school to assess for an abdominal aortic aneurysm by putting fingers in a triangle around the belly button, so I did this. And as soon as I did, I saw my hands pulsating strongly back at me. Immediately, I started crapping my pants, ordered the man a CT, which showed an abdominal aortic aneurysm with an outpouching with an extremely thin wall. This guy was immediately moved from Miners to Rhesus and then straight to surgery. Surgeons say if head sneezed, it would have ruptured. Very bad news. You would lose your entire blood volume in mere minutes. I looked him up afterwards, and amazingly, he survived to discharge hospital following surgery, although don't know how he did long term. Was pretty terrifying for me, as you could potentially have mistaken that for a hernia or fecal loading if you didn't examine him properly, but that's probably my main time I saved a life story. Story 18, urologist here. A healthy patient came in with a few-month history of left-hand numbness. My first thought was carpal tunnel syndrome, but physical exam was not very convincing. I got CT head and found malignant metastatic lesions. Patient and family were talking about expensive designer bags. We're very happy I had to break the news. They went from healthy to potentially a few months to live. Sometimes I hate my job. Edit, I am reading replies of people getting worried about their loved one's symptoms. Remember, cancer is incredibly rare. Everything else is much more likely to be the case. Story 19, my local hospital sent me home twice after I went there for chest pains. I had a massive heart attack, and my son had to resuscitate me soon after arriving home the second time. Story 20, I'm not a doctor, but I have two. I had a doctor appointment, just a 6-month checkup for my diabetes. My heart rate was up, so my doctor sent me to the ER for blood work. Turns out I was having a weird version of diabetic ketoacidosis, where my blood sugar wasn't elevated anion gap. They kept me in ICU for a week. My mom went to her doctor for shortness of breath. He told her she was old and overweight. We took her to the ER, where they drained a couple of liters of fluid off her lungs. Her breast cancer from 5 years earlier had returned, metastasized, and invaded every bone in her body, her lungs, and her brain. She died 5 weeks later. Story 21, not a doctor, annoying, I know, but my mom kept having foot pain, told her it was plantar fasciitis, wouldn't heal, then told her it was a fracture, wouldn't heal, then told her there was a growth, did a biopsy, and it was lung cancer, stage 4, so from foot pain to lung cancer, totally wild. She has also never smoked a day in her life. Story 22, I'm a nurse, so naturally my mother called me one day, when she had strange symptoms. Earlier today, I had this feeling like there was a squirrel running around in my belly. I reassured her that it was probably gas. It happened again a few days later when she was in the car with me. Something made me take her right to the emergency room. The doctor evaluated her and basically accused her of making things up. I asked for a different doctor because she is not a complainer or a drug seeker. Turns out it was a malignant brain tumor glioblastoma that was manifesting itself as abdominal seizures. They said she had 1 to 2 years to live. It is now 7 years since surgery, chemo, and radiation, and she is still alive. Story 23, not a doctor, but my husband suddenly lost 15 pounds over a few days. No changes to diet or exercise. I told him it sounded like diabetes, and please go. He finally went after a week, and by that time he was skin and bones. It was diabetes, and his blood sugar level was dangerously high. The doc said if he had waited one more day, he might have gone into a coma. Story 24, had a friend who had back pain in her lower back. Put it off because it was the beginning of COVID. By the time she finally went, they found out she had tumors all over her spine. Story 25, not a doctor, just answering for myself. Also, I don't really know if it can be considered a serious life or death situation. Had post-concussion syndrome and already had MRI done. It was nothing out of the ordinary. Then one day about a month later, I got up and suddenly fainted. Consulted my doctors, and they all agreed it was likely a one-off and I was fine to go travel, but they still thought to be on the safe side I should do another MRI scan when I returned. I had a great few weeks traveling, and that included lots of outdoors and sports stuff. Then I came back and went for my scan, this time with contrast. By that point, I honestly felt like I was wasting time and money. So imagine my shock when the results came out, and I was told I had a brain tumor. I later found out that people with the type of brain tumor I am suspected to have tend to have it manifest through seizures. I just happen to have mine in a dead area, so I just never had any symptoms at all. I've since had it taken out, and we're waiting on the histopathology to get back. Story 26, hubby went to EE with shoulder ache. He had wrenched it a few days before they sent him home with codeine, said to go back if it didn't improve. It didn't, so 3 days later we returned this time. They x-rayed, showed nothing. So they did an ECG. Within seconds they were racing around, inserting cannulas, etc. Blue lighted him to another hospital straight into the cath lab, where they removed 5 clots from one side of his heart, a massive clot widowmaker from the other. Inserted 2 stents. Cardiologist admitted he doesn't know how hubby survived, said he probably had a minute or 2 to live. 12 years later, he's still here after surviving another heart attack 4 years after the 1SD at Dunnington Monsters of Rock Festival. One lucky man, one grateful wife. Story 27, this is a story from my mother who was a therapist. She was treating a teenager who basically was masturbating so hard and often that he was rubbing his junk and bleeding through his pants. The kid insisted it wasn't, he was just really uncomfortable and his skin hurt. He got boners rubbing the skin. The doctors didn't believe him and sent him to my mother, my mom. Devil she was, had a saintly moment and listened to the kid. She suggested he see a dermatologist. Kid literally had cancer, something with an S, cell carcinoma. My mother never saw the patient after their parents called to cancel appointments because they found the cause and he was no longer in need of her services. Story 28, as a resident. I had someone come to clinic to resume routine care for routine screenings after an older sibling had past reason for visit CC. I want to take better care of my health. I noticed they had a little bit of blood on their napkin and asked to examine their mouth, a few missing teeth, and a massive mass on their gums. Immediately sent them to ENT, where they learned that it was oral cancer. They'd eventually get the whole enchilada of mandibulectomy jaw resection, glossectomy, tongue removal, and I think even neck dissection and laryngectomy. I followed them peripherally on a consulting service until they ultimately passed away in hospital about a year later. The cruel irony of the whole thing is even worse when I wonder if he would have had better quality end of life if ID never bothered looking and it had just taken its natural course. Just more reasons to avoid tobacco and alcohol. 80 of oral cancers attributable to their consumption and eat plants. Story 29, patient presented at the ER complaining of back pain. They gave him prescription strength ibuprofen and sent him home. His back pain became excruciating, and he ended up being life-flighted to our hospital with a dissecting abdominal aneurysm. Poor guy was on ECMO for days before he passed away. Story 30, 26-year-old, seemingly healthy male, came to my office, eye doctor, with complaints of mild blurry vision. usually a very routine complaint and very easy fix with glasses contacts. After a few minutes of trying to get him see better with the refracting lenses, I wasn't able to improve his vision when it shouldn't take that long for someone that young. I decided to quit trying and quickly look in the back of his eyes, hemorrhages everywhere, swollen optic nerves. He ended up having malignant hypertension causing his retinae to swell. His blood pressure was 270,170 in office, which could have made him have a stroke at any minute. We physically drove him to the ER where he was admitted. Story 31 wasn't life-threatening, but I fell and got a few stitches in my knee as a teen. The hospital wasn't the best, and I wasn't even fully numb when they stitched me. I was screaming in pain from the needle and sutures, and 2 nurses were holding me down as they finished. However, the first week or 2, I noticed I couldn't walk right. My knee, couldn't bend due to the stitches, so didn't think much of it. When they finally came out, I still couldn't bend my knee, but figured it was just weak and stiff from being straight for 2 weeks. It still hurt a lot over the following week, and found I was literally dragging my leg behind me as I still could not bend it. My dad was the type put some dirt in it, son. Don't be a baby, and he's the one who took me to the doctor on why I'm dragging my leg like a sack of potatoes. Doctor took one look at it and exclaimed I need to go to the hospital right away. Even threatened that if I didn't go, they would have to cut off my leg, TBH. I think she was embellishing, but the scary part, not by much, this hospital was really good compared to the one I initially got the stitches at. Turned out I had an infection in the knee that needed several days, 4 antibiotics. They did proper scans of my knee and found I not only blew my patellar tendon, primarily why I couldn't bend my knee, I also mildly fractured the bone itself, which was impressive to do. Story 32, I was the patient. We had gone to India for a wedding, absolutely incredible, and naturally our North American digestive tracts. Everyone suffered from deli belly. I was hit harder than most, almost didn't get on our flight home, because I was worried about having to use the bathroom if the seatbelt sign was on, or if there was a lineup. Ultimately got home. Everyone in the group, about 12 people, were feeling better, but I was still having some minor gastro issues, nothing crazy. Still working and living normal life. Went to a walk-in because my family doc couldn't see me for at least 2 weeks. Walk-in doc ordered some tests and prescribed an antibiotic. I got a call, the test came back negative, but if I was still feeling unwell to come back, this was like 2 weeks after my first visit, I debated but decided to go back. Turns out they never ran the E. coli test, so they run that again. Doc said she'll call me when the results were in. I didn't hear back, but my now Amila doc caught wind. I was still dealing with gastro issues and asked if she could call the lab to get my results. I said, sure, that would be great. In the meantime, a friend is visiting from out of town and I wanted to show her a good time. So we went out dancing. At some point in the evening, my now MIL had called me something like 17 times, leaving voicemails and texts to get to the hospital ASAP. Don't go home to change. Don't get public transit IE cab because ITLL be faster. Just go straight to the hospital. The nurses were absolutely floored the E. coli hadn't gotten in my bloodstream. This was about a month after our trip. Apparently my urine test came back absolutely overrun with an antibiotic-resistant E. coli. Best part, the walk-in doc finally called me about a week after my hospital visit telling me she has the results and I should come see her. My MIL happened to be standing beside me when I received the call and asked to talk to the doc. As a teacher at the university here, the walk-in doc knew who she was and had to walk my MIL through my case to identify all the ways she let me down as a patient, including asking me to come into the clinic instead of rushing to the hospital. I'm totally fine now and remain forever grateful to my now MIL. Story 33, I did, among my other jobs, administrative physical exams for my employer for decades. This happened over 2 decades ago. Patients had a chest x-ray and some basic labs before they were seen. I got an x-ray report that said the patient's mediastinum appeared a bit wide, and I should consider a CT scan to evaluate for an aneurysm of the aorta. Whoops, I called the patient whom I had never seen. He was not having any chest pain and felt like his usual self, but agreed to have the chest CT done. For whatever reason, radiology did not do a full chest CT as I had ordered, but did one limited to the aortic arch and below. The aorta and mediastinum were normal, but the CT report mentioned some minor stranding extending from the left hilum of the lung, extending towards the left upper lobe, which was not shown on the CT because they did a limited exam. Okay, I called the patient back, whom I still had never seen, and told him what the CT scan showed. Upon questioning, he said he had some minor pain in his left scapular area behind the shoulder a year before, and he had seen a clinic at a different hospital, which had done a series of x-rays, and nothing was wrong. The upper back shoulder pain had not really changed over the intervening year, and he had grown used to it, the vicissitudes of aging. So I reordered a chest CT and asked radiology to do it as ordered. which a few days later they did. Double oops, the full CT scan showed a Pancoast tumor at the apex top of the left lung that had extended into the chest wall and destroyed segments of several posterior ribs, which explained the pain the patient was having. This is a very bad thing. I called the patient back again. His appointment to see me was not for several weeks, and he needed to know. He took the very bad news surprisingly well, got copies of the CT scan, and went to a local cancer hospital for further evaluation and treatment. I never actually saw him. Story 34. My son, 6 weeks old. He was also 6 weeks premature. Only symptoms at the time of me bringing him to the ER was inconsolable crying and wouldn't drink his breast milk, was told by others that I was just being a paranoid first-time mom, probably has gas or was colic. My instincts just told me otherwise. Brought him to the ear triage, asked me what my concerns are. I told them he won't stop crying and I can get him to eat. A couple hours later, my 6-week-old baby coded blue and went into respiratory failure. Code blue pediatrics will forever be the most haunting thing I ever heard. Since he was so tiny, they were having incredibly difficulty intubating him. Was being kept alive in between attempts with that bag thingy, unsure what it's called, and compressions. His diagnosis was late onset group B strep, sepsis, and bacterial meningitis. Had I not brought him in when I did and waited, my son would not be alive today. So yeah, listen to your instincts. You have them for a reason. Story 35. Not a doctor. I work in a CAT scan department. Had a patient who came to the ER because she thought she was pregnant and wanted a test happen so often. Why they just don't get a test at CVS. Pregnancy test was negative, and they sent her to me for a scan. Patient tells me she was having symptoms from her last pregnancy. Turns out she was having right-sided heart failure. Story 36. Obligatory. Not a doctor. Had a 38-week pregnant woman with twins come in with a primary complaint of shortness of breath with exertion. She was 410. I'm thinking, of course, your SOB as short as you are with term twins. I was pretty sure we'd do an NST and send her home. Her BP was 170110, so we did blood work. And she was in HELLP syndrome. Platelets were 42,000. We were lucky she came in when she did. Story 37. 8-year-old girl gets brought in complaining about back pain. She had had for 3 months. Several different doctors had given her painkillers to no avail. After about 5 minutes, I asked her if she had any problems going to the toilet. She says it's foamy when she pees, bone cancer. She made a full recovery, and from what I know is in her 20s now. But to this day, I hate how she had been suffering for 3 months, and no other doctor had bothered to even ask any more questions as to why an 8-year-old girl was getting severe back pain. Story 38. My husband was a pathologist assistant for 30 years and did autopsies. Guy goes to ER feeling unwell. A couple tests are performed, and he's diagnosed with stress, which means I don't know, and sent home. ER shift change, quiet time in the ER, and a board doctor reviews cases from earlier in the day. She sees something she doesn't like in this guy's test results and sends an ambulance to the guy's house to bring him back. Dead on the floor inside the door. Poor guy ends up on my husband's table, and the hospital gets sued. Story 39. Not a doctor, but I had a massive headache, fainting, and extreme light sensitivity. Doctor came and said it was sinusitis I struggled on. Saw another DR at same practice who confirmed sinusitis, started slowly recovering, but had extreme vertigo. Got a second opinion, confirmed sinusitis. Went private, was in the UK, and was seen by very dismissive DR. I insisted on further tests, and he reluctantly ordered an MRI. Turns out I had meningitis. Story 40. NAD, but I had a migrating headache kept moving from base of skull to top for over a week. Non-stop, just kept on there. I ignored it and chalked it off to being in front of a computer all day. Started getting a pain behind my right eye. Still thought it was the computer. Everyone kept telling me I should probably go to the hospital, and I kept saying no because I didn't want to deal with waiting in the ER for them to say, I need to sleep more. Well, I went, and they took me back thinking I had bacterial meningitis, got a horrible spinal tap, and came back negative. The only conclusion was my immune system was attacking itself, and that if I had waited any longer than the week I already did, my immune system wouldn't have responded to any medication and just kill me thinking I was sick. Fun times. Fun times. Story 41. Paramedic, not a doctor, a woman called 911 requesting an ambulance. When my brand new rookie MT got there, she complained of just not feeling well and having a mild headache. I did my assessment, and everything looked perfectly normal, except it seemed she might have a cold with a headache. I didn't think she needed to be seen in ER, and told her so. She wavered back and forth, and then finally agreed to sign a refusal. I sent my rookie partner out to get the clipboard, but he pulled me aside and told me he thought she needed to go. I asked him why, and the best he could do was I just have a feeling. So I finally relented and told him, fine, Your patient I'm driving a few blocks down the road, he leaned up front and asked me to make it hot light sirens. I rolled my eyes, but did what he asked. At the ED, the grumpy triage nurse came up to me a few minutes later and wanted to know why we transported a perfectly healthy woman with a cold and headache. I just nodded toward my partner and said, "You'll have to ask him." Anyway, we left, but a few hours later we were at the same ED, and that same nurse came up to me and told me the news. Because of the headache, the doc had ordered a CT scan, and lo and behold, there was a dissecting aneurysm right next to her brainstem. She had been shipped out to the trauma center by helicopter and was undergoing emergency surgery. I learned later that she survived without deficits. Holy, if ID had a more experienced partner that day, she would have ended up dead, and it would have been my fault. Story 42, not a doctor, but work in health, had a patient that went to her GP thinking she had arthritis in the knee from an old surgery and came back with a diagnosis of motor neuron disease. Story 43, I thought I pulled a calf muscle. I did the whole RISE protocol, but nothing helped. I was limping because of the pain. I ended up on urgent care, which was a waste of time because it could be a blood clot, so they sent me to the ER. The ER did an ultrasound of my leg and found nothing, so they gave me muscle relaxers and sent me home. They noted I should follow up with my PCP, though because my blood pressure was really high, I chalked it up to the anxiety of being evaluated for a blood clot. A few days later, I developed this little cough and an intermittent sharp pain between my shoulder blades on deep inhales. Being that this was September 2020, I thought that this was for sure COVID, but I also then remembered that I needed to follow up with my PCP about the blood pressure thing. So I called to talk about both items at once. The nurse was alarmed and told me in no uncertain terms to go straight to the ER to be evaluated for a pulmonary embolism. And that's how I found out that I had multiple bilateral pulmonary embolisms. Story 44, my husband went in for a routine checkup. His blood work was fine. Everything was fine. The only thing was him saying he just a little more tired than usual. His doctor noticed that he was due for a colonoscopy and set one up for him. The DR who did the colonoscopy said everything looked good, but he just felt there was something up. So my husband went back to his regular DR, and she did a complete look at him. Blood work showed a very slight increase of white blood cells. So she decided let's do an abdominal scan just to do a look-see since the colonoscopy DR didn't feel quite right about things, even though there was nothing showing. Apparently his appendix was inflamed, and surgery was scheduled to take it out upon removal. Not only was it inflamed, but infected and cancerous as well. Turns out that it was confined at that time to the appendix B. It was a particularly nasty little cancer that likes to spread. C, the cancer was at the far part of the appendix. So when they removed the appendix, the margins were clear. D, it led to the discovery of him actually having a genetic issue called Lynch syndrome, which they were able to figure out was through the maternal line. Turns out that his mom's uterine cancers, his uncle's death of colon cancer, and his grandmother's various cancer issues were all related to this genetic abnormality. If he hadn't gone in for his checkup and procrastinated, his appendix would have gotten worse, and the cancer would have spread. There's a good chance the cancer would have gotten into his intestines and ended up with intestinal cancer of some sort if they hadn't gotten it. He is still very susceptible to getting cancers because of this genetic condition. He found out early enough to be able to be proactive enough for care and prevention. It's been almost 10 years since diagnosis, and he has been healthy as a horse since then. He gets a colonoscopy every year because of it, but that's a small price to pay. Story 45, obligatory, not the doctor. I had a cough that wouldn't go away. Chest x-ray found a spot on my thyroid. Ended up having it removed as it was cancerous. Cough ended up being asthma. Story 46, veterinarian, not MD. During my internship, a woman came in with her 6-year-old Labrador around 1 a.m. Lab lady, my dog, needs an ultrasound. Me, oh, what are you seeing that you're concerned about? Lab lady, she left the house to go out on the porch this evening. And then she just laid down. Me, is she eating and drinking okay? Any other issues? Lab lady, everything else is fine. But something's wrong with her. Me, well, how about we start with some x-rays? X-rays are taken. There's a very obvious splenic mass. Me, ma'am, your dog needs an ultrasound. Long story short, it was lymphoma in the spleen. They did everything they could and bought her another 10 months or so. Very good dog and devoted owner. Story 47, not a doctor, but my dad went to his DR because of a stuffy nose that had been going on for weeks. Doctor looks in his nose and noted a deviated septum. Said that's not right and sent him for tests. My dad had a brain tumor size of a grapefruit with no symptoms other than a plugged up nose, so he went in with a cold and came out with cancer. Story 48, not a doctor. We had to gently tell a co-worker her that she needed a morning shower and her deodorant. She went to the doctor to get it checked out, and turns out she had a severely prolapsed uterus, and it was infected. We felt terrible telling her she had BO, but thankful she got a very serious situation checked out. Story 49, I was the patient in this one. My kid was 2 and had a bad cold. Nothing crazy, just a bit wheezy, a croup-sounding cough, and sleeping a ton. My MIL was babysitting him and called me at work to get my opinion on how to treat him. I figured he was fine, but she was worried, so she called the nurse line. The nurse said he was likely fine, but we should bring him in just to be safe, so I went home and brought him to the hospital. We were talking the entire drive to the hospital. He was acting like a typical preschooler with a cold. It was just his breathing that sounded a little weird. I actually apologized to the nurse when we got into triage because I thought we were wasting her time. She took one look at his breathing, told me to follow her, and speed walked us back to her room. Yeah, he was having a major asthma attack, and his oxygen was in the low 70s. My MIL likely prevented a way worse outcome by being a worry ward. He had asthma attacks every time he had a cold until he was like 5 and grew out of them. It was terrifying. Story 50 went to ER for a headache ID had for 2 weeks. Doctor wanted to give me allergy meds and send me home. My GP had told me to demand a CT with contrast, subdural hematoma, had emergency surgery a few hours later, and spent 8 days in ICU with a drain tube in my skull. Women often aren't taken seriously regarding pain. You're your own best advocate.